Okay. Thanks a lot. It's really a great pleasure to be here today. It's really nice to see that the issue of data has been mentioned in the other sessions. So it's something that it's important for the ecosystem. We have been working in this proposed regulation called European Health Data Spaces, supporting the European Commission and the European Parliament. And for me, it's a great pleasure to be here today because it's not just about one actor. Normally, these events are just one actor, industry talking to industry, healthcare professionals talking to healthcare professionals, government talking to government. So the fact that we have here today the full ecosystem, I think it's a great, great advantage for all of us, and to make the European Health Data Spaces happen. I will give the floor to the 4 panelists, including our colleague who is online. Can you hear us well?
I can hear you very well, thank you.
Yes,
and you can hear me?
Yes, perfect.
Excellent, thank you.
Okay, so it's good to have someone online because then we remember that there are many people also watching the event online, okay? So I'm quite sure that all of you are familiar with the European Health Data Space. Just two major comments, or just two issues. First, it's about the use of health data for primary and secondary use, okay? Today we are gonna focus on secondary use. And together with the panelists, we hope to trigger a discussion, again, with the whole ecosystem, not just one actor, but the government, the health tech sector, the bioregions, and national, regional, and sectorial level, okay? So let me ask you first, Jordi, and the same question is gonna be for the 4th panelist. What do you think about the opportunities and challenges of this proposed regulation that is currently discussed at the Council?
Yeah, thank you for having me today. So I truly think that, I mean, the opportunities are enormous, obviously, and in this context, if we start to think about use cases for both primary and secondary use of data, we will never end up this conversation. So I think for me, if I have to choose one, I would say that the biggest and the only one for me, it's the possibility to transform our healthcare systems towards digitally enabled, data-driven healthcare systems. And with this, I'm saying that we are finally adopting data to make and pick decisions all together and with a single truth, I would say. When it comes to the challenges, I would say that we have 3 of them. For me, the first one relates to, well, how is the regulation going to look like at the end, and which is the transposition that it will have here in Catalonia and also in Spain, obviously. The second one is the governance. I mean, the governance will be a complex one. We are talking about a very complex ecosystem, which is some sort of a federation, and I'm worried about the governance. And then maybe a third one, which is, it relates to the technical infrastructure. There's some projects, the TEDAs, the EDA projects that are working in defining those, but there's no clarity yet on how technically European health data spaces are feasible. So that's for me the one opportunity and the 3 challenges.
Thanks a lot. In our case, we have our colleague online, so I will request Montse and Sven to introduce yourself because the name is not on the screen. So just say your name and your position. Montse, the same question, please.
Montserrat Daban from Biocat. Yeah, when you ask about the challenges and the opportunities, I think that we're seeing them every day. In terms of challenges, of course, how to make coexist the regulation of the eventual European health data space with the existing legislations in the different EU countries. That's a major challenge, and it's going to be one of the most difficult. And that involves also a lot of communication and dissemination on what EDHS will imply, or which is going to have to be the impact of that for the patients and for the transformation of the health system. That is a challenge, of course. And also a challenge is governance, but not data governance only. The governance of the whole structure that is going to eventually also support this deployment. The board, the role of the different ministries, the different members, the different EU countries, the different organizations, the observers, and that's, I mean, way ahead, but we have to look at that because otherwise there's not going to be a European health data space to deploy. And in terms of opportunities, having together in a room such a diversity of stakeholders, some of them are going to be users of this secondary use of data, and they have to be actively requesting this potentiality of the use of those data, the right use of data, and having those the policymakers. So opportunities, from my perspective, is also making profit of everything that the Commission is putting in place in terms of policies, like the Green Deal industrial plan, for example, or other policies that are going to support actually the driver for all stakeholders at policy level making to help deploy the EHDS. That's the opportunity also.
Thanks a lot, Montse. Sven?
Yes, hi, I'm Sven Parkel from Balt. I'm the Secretary General, and Balt is a network of clusters. We're sort of a meta-cluster, a network of innovation stakeholders around Baltic Sea region, and we've been keen supporters of European health data space for, let's say, since 2019, 2020 already, and our members were a network organization, membership organization, so our members understand and realize the enormous potential that this kind of new, not just infrastructure, but this type of mentality contains. And we've been showing our support through European presidencies. So we've been holding events that discuss on a high political level on the concept of European health data space and everything that relates to this. And secondary use of data is definitely one of the main aspects when we're considering this kind of infrastructure. So when we're talking about what can be done, so from Estonian view, we already sort of have a bit of understanding how this could work, and here I'm talking about Estonian Genome Bank and the fact that 99% of our medical data in Estonia and also prescription data is digital, and in addition to that, many other types of data. And what we have been doing is, with the help of Estonian Genome Bank, is play around with that data to develop novel business model and to better understand what may be the causative reasons behind different diseases. So sort of we appreciate this potential and this kind of access to the sets of secondary data. We think that it's very relevant when we keep in mind the main purpose of the healthcare is to make people healthy or keep them from getting sick. So in this sense, I think it's very, very valuable. When we're talking about challenges, then we have had a couple of events in different EU presidencies and seen this debate as well. I think it's, to some extent, it's quite difficult to make very binding decisions in the area which is highly regulated, where there's a lot of sensitive data involved. So it has to be thought through very thoroughly. But of course, in a way, this is one of the bigger barriers as well, that it's quite difficult and challenging to set up this kind of huge infrastructure.
Thanks a lot, Sven. And now we give the floor to Michel online. Can you hear us?
I can hear you, yes. Thank you.
So, about the opportunities and challenge.
Yes. Just briefly, my name is Michel Silvestri, and I'm head of unit at the Swedish eHealth agency, the coordination department. I can also mention that I'm member of the Swedish negotiation team when it comes to EHDS negotiations, and due to the presidency right now in the EU, we're also responsible for the negotiations and chairing the meetings with the other member states. But we will with warm hands hand over that to Spain in half a year from now. So even in a shorter time than that. Regarding the opportunities and challenges, I would say that with the EHGS, we can see enormous opportunities when it comes to research, innovation, improving healthcare, improving policy making decisions. But at the same time, we have several huge challenges, or at least challenges that we need to take very seriously. And one, of course, is to look at the balance between sharing of data, making it accessible for research, innovation, etc. At the same time as we really safeguard the integrity of the individuals who have contributed with this data to this system, so to say. Other challenges are, of course, perhaps more connected to the negotiation work ongoing with kind of a debate or a discussion about the balance, again, between the member states, their autonomy when it comes to healthcare in relation to the Commission, which is getting increased mandate according to the EHDS proposal, at least. So we need the driving force of the Commission, of course, when it comes to delegated acts, etc., implementing acts. But at the same time, the member states, of course, want to see that they have enough mandate when it comes to legal autonomy regarding healthcare issues, for instance. Then we have other challenges such as definitions. How do we define personal health data, non-personal health data, anonymized, pseudonymized? How do we define an electronic health record system, etc.? So we have to work on those matters as well. Not to talk about the time plan presented in the EHDS proposal, which is also a challenge in itself, I would say. I'll stop there for now. Thank you.
Thanks a lot. So several opportunities and challenges have been mentioned. Today in the morning, there was a panelist talking about the GDPR and as a blocker. No? I like to see the European health data spaces as an enabler, while we keep the, let's say, the fundamental rights untouched, we can push or boost innovation. If we want to see that happen, what would you say are the key success factors? Like 1, 2, or maximum of we need to do that within your roles in your different positions. Jordi, again, first.
I will mention 3, if you don't mind.
Yes.
The first one for me, it's cultural, and it has a lot to do with how we explain what European health data spaces are, both to citizens and professionals, and for them to accept that we are going to move this data all across Europe for whatever intended use we are willing to give to this data. I would say that, for example, here in Catalonia, we are quite fine with this, and I would say also in Spain, we've been sharing healthcare data for the past 16 years successfully, and it's the opposite. It's when our professionals or citizens, they do not have the data, well, they get angry in that sense, but this is not the same in all of Europe. We know that, for example, in France, the liberal professions, such as the GPs, they are very powerful and they do not want to share their data. So first one, for me, it's cultural and links to the way we disseminate the idea of the European health data spaces. The second, Montse was mentioning at the beginning, and it's how do we intertwine the regulation with the local regulations and how we make things happen. Also here in Catalonia, we have a regulation that allows us to do so for primary usage, and then we also have another regulation that allows us to reuse this data for secondary usage from the Catalan Agency for Quality Assessment in Healthcare. And we are quite advanced also in that part, but again, it's not the same all across Europe. We know, for example, that in the Netherlands, the citizens voted against their data to be pooled by the public sector and this data to be shared. So how to overcome this and how to link it to the local regulations. And then the last one, as I mentioned at the beginning, it's for me it's a technical problem. How this infrastructure will look like. We have how do we save the barriers of interoperability of this data, and which are the standards that at the end the European health data spaces will be using. I mean, if we are thinking just about a data lake where we drop the information the way we have it, it won't have much usage. So we need to reach some sort of agreement in between those standards and have some sort of confluence of, well, the representation of the knowledge in the clinical domain in one unique way and not in many ways as we have now.
Thanks a lot, Jordi. Montse?
Yeah, so for me, the first question is, do we really want it? I mean, why do we want its deployment of the European health data space? Because this transforms our health systems, because it represents also huge savings for the health systems as well. It represents also the patients being more capable to doing things across the EU that are harmonized for their health. So do we really want that? And then if we do, then of course, there are things that we have to push together to attain, for example, infrastructures, data sets, the talent. Pep Martorell referred to talent also. That's key, because we need this talent, we need these people that is trained to manage these aspects from all the layers. I mean, from all the stakeholders, from policymakers, from the industry, from the research organizations, and also from the society itself, understanding what it means. Then there's another key factor for success that we are seeing in the project that kind of connects all us today here in this panel, which is the EDA that we, from Biocat, and I'm speaking here as a coordinator of the project, but this is a project that was conceptualized by Balt, and then we have Sven here also. So we're working in this project together as partners, and what this project intends to do is seeing how ready are the different innovation ecosystems in Europe to help deploy the European health data space. And for one, we are working with the right people at the right places in the different countries that are holding the presidencies of the EU. And that's why also we thank Michel Silvestri to join us today, because he represents the Swedish. But Sven worked with Balt, with the previous one, with Germany, with France, with Portugal. And we are working now with we have finished the case study on the Czech Republic and also on Portugal, and we are working on the Swedish one, but we will work on the Spanish one as well. So we need to make sure that we understand which are the drivers, the enablers, the barriers to the European health data space. That is another thing. And when we look at what happened with the Czech presidency, we are working on this case study, but we are also following what happened in those 6 months. They just reached to talk about GDPR. So that is key, but I mean, we cannot think that EHS is about e-prescriptions, because we cannot stop there. So that's what we are doing with the different EU presidencies, trying to prioritize this discussion on the right tables, on the right agendas, to move forward all together at all levels of the different stakeholders. That is key, having all stakeholders. And I think I'm going to stop there because it's taking a lot of time, but I think that we definitely need to, ask ourselves why and what is going to be beneficial for our health systems if we accomplish this deployment.
Thanks.
Maybe I would add the dimension of the consent, which patient consent, which of course relates to the GDPR, which was already mentioned here. But when we look at Estonia Genome Bank, which was set up 20 years ago, then the consent that people give when they give their donation to the Genome Bank is compliant to the new GDPR rules. So already 20 years ago, we thought about it, how to set this infrastructure up in a way that it's possible to use it for good research purposes. And it means that these days it is possible if you have an interesting finding there and there's a research problem that could be solved, then it is possible to connect, to go back to the people and connect to them and say that, I mean, they're not automatically included, but it's possible to invite them to be part of this new study and learn more about themselves as well. So I think this is important, and once we bring in the companies and the discussion goes a little bit there, whether the people's health data should be used for companies who may be making some kind of profits theoretically out of it. So it leaves a little bit of management, but maybe the understanding how to set up this concept and how to go about it is also a necessary view.
Thanks a lot, Sven. Michel?
Thank you. Actually, when introducing this question, you mentioned GDPR, and I think that, I mean, you've touched upon, I think, perhaps most of the four interoperability layers that we often describe, which are the legal layer, the technical, the semantic, and the organizational. And actually, I've also been and still am involved in the TEDAS joint action, the EU project on secondary use of health data when building EHDS, so to say. And in one of the studies in TEDAS, we've seen that actually the main barrier seems to be the legal unclarities, and especially perhaps connected to GDPR, where we have different interpretations in the different member states, and also that member states may have additional national legislation and regulation on these matters. That, of course, when we try to collaborate within the umbrella of EHDS, that will complicate things. So actually quite recently, or if it's just in a day or so from now, we're publishing one of the last reports in the TEDAS project, which contains recommendations on national basis regarding legislation and regulation. So in that case, I would recommend to look at some of those recommendations, which could be something like consent, which was Sven mentioned quite earlier here, in relation to another kind of legal basis, which could be legal, which could be public good, for instance. And I think that is a difference between some of the member states in the European Union, that in countries where you have perhaps a larger trust in the government, in the state, so to say. In those cases, you can also perhaps have public good as a legal basis for sharing health data for both research, innovation, and other purposes. Another thing could be that in some states, you may have additional regulation which is a barrier to exchange, to share health data cross-border, perhaps for security reasons. But again, that is perhaps one of the possible barriers when it comes to health data exchange when preparing for the EHDS. I think I'll stop there. Thank you.
Well, I see the countdown. We have 20 seconds, so I would like to thank the panelists for sticking to the time and for the interesting conversation, and I hope the audience here and online enjoy the talk. Thank you very much.
Thank you.
Thank you.
Muchas gracias.